Thank you for having me. I'm Alex Harris, a partner with McKinsey's Health Systems and Services practice based in Washington, D.C. I spend the majority of my time working with public and private sector health systems. And today I'm going to share with you some of our perspectives around virtual health, specifically around what we see the potential for the space being, and also some of the major barriers we see to adoption. Now, it goes without saying that we are already in an everything digital world, and these data points on the slide really bear that out. This is true now even more so than ever before, with the majority of us spending most of each of our days interacting with technology, both in our professional and our personal lives. Now, this radical digitization has been happening across industries, and a number of supply and demand factors are at play. On the supply side, from a technology perspective, technology has permeated more industries and services than ever before. And that technology has become more sophisticated in meeting our needs, along with easier to use and more efficient to scale. On the consumer side of the world, consumers have rising expectations for experience and rising comfort with using digital channels. In addition, consumers are more comfortable than ever before in sharing information with third parties, rapidly changing others' access to consumer data. As these forces converge, we're seeing radical change across a variety of industries. As traditional barriers break down and consumers access services and information in completely different ways. And as consumers access these services in different ways, significant changes happen for the position of industry players. Banking and financial services, for example, is often cited. So now let's talk about healthcare. It will be no surprise to say that healthcare has lagged behind other industries. In a McKinsey Global Institute analysis of labor digitization, the analysis found that healthcare was at the bottom of industries in terms of digitization, alongside industries like mining and construction. Now, certainly significant investment has been put into healthcare on the technology side, and that's only been accelerating. In 2019, $2 billion of venture capital and private equity investment was directed towards tech-enabled care delivery startups. And we've seen a blistering pace of investment and M&A through year-to-date 2020. Now, that being said, we still believe this falls well short of the adoption potential for digitization and virtual health usage in healthcare, and hasn't yet cracked the code on helping solve some of the cost and capacity issues at play in the industry. So let's dig into some of that data on potential. To look at the potential for virtual health, we looked at the $1.2 trillion of medical claims spent in the outpatient and the home health settings. And what we did is look at the code level to try to identify specific interactions that could be managed virtually versus face to face. And what we found in doing that analysis was that nearly 20% of spend, or $250 billion, had the potential to be managed virtually. And that came in the form of a number of different types of services or substitutes. So, for example, in the ED, we found that 20% of visits had the potential to be managed via modalities like telehealth or e-triage. And in the outpatient office visit setting, nearly a quarter of visits with the potential to be managed virtually. So this gives a sense of the large potential of virtual health. And then I'll just say that potential does not equate to adoption. So we wanted to look at some other measures of the trajectory of virtual health. One of the ways we did that, and this is pre-COVID, we took a survey of health systems executives and asked them what their investment plans were across virtual health applications. And what we saw that the majority, 77%, had already invested in things like synchronous telemedicine technology. And I'd venture to guess more of them have gotten above this 90% than would have been contemplated when we asked about the 5 to 10 year time frame back pre-pandemic. In terms of the future, the majority said that they would be investing across a portfolio of healthcare application, virtual health applications. So that ranges from asynchronous telemedicine to patient engagement to remote monitoring and things like e-triage. And we heard from them that they aimed to put together a more holistic portfolio of technologies to meet the needs that they see consumers having around convenience and access to care. Now, that was pre COVID. So, now moving to the COVID-19 experience, certainly COVID-19 has been a major accelerant for the use of virtual health. On the consumer side, fear of fear of face-to-face interaction and restrictions on movement, along with this comfort with everything digital, has seen a major shift into virtual health applications. On the regulatory side, CMS has made reimbursement parity for telehealth services a priority, along with loosening licensing restrictions for providers to allow a wider range of practice. We're also seeing moves towards more interoperability, which has been a long journey for the industry and an area that will enable more virtual health usage going forward. On the industry player side, we're seeing technology companies, payers, providers, states, all scrambling to put together their own solutions and scale them during pandemic times, whether that's states implementing e-triage services for COVID symptoms, payers increasing access for their members to telebehavioral health services, or providers enhancing their tele-ICU and remote monitoring capabilities. We're seeing a range of solutions being scaled and developed. We're also hearing from a range of stakeholders that there are significant mindset and behavior changes happening during the pandemic. On the consumer side, and this is from a recent consumer survey we've run, nearly 75% of consumers indicated that they were likely or very likely to schedule a telemedicine appointment in the future. And there have been a number of questions about whether this persists across age ranges. And what we've found is that more than 60% of those respondents over the age of 65 also indicated that they were likely or very likely to schedule a future telemedicine appointment. On the industry executive side, we're hearing things like the genie is out of the bottle. Members are going to want to continue with these services, and it will be difficult to entirely wind back telehealth for some types of encounters. It's likely here to stay. At the same time, we're seeing significant innovation in a concept we're calling healthcare ecosystems. The idea of a holistic, coordinated experience for patients that aggregates data and helps them manage across home settings of care, traditional care, social care, daily life activities, and the underarching financial support for all of their healthcare needs. An interesting industry example of this is Apollo 24/7, a platform started by Apollo hospitals in India that we recently profiled on McKinsey.com. This platform allows patients and members to access physician consults, medication ordering, health information, and a variety of other services. And many of these features were put in place just before the pandemic. And talk about scaling, the organization reports 4 million users being connected to about 7,000 providers. So, real evidence of innovation and uptake that we're seeing accelerated by COVID. Now, that being said, despite the acceleration, we've already seen exponential growth, peak, decline, and plateau in telehealth usage over the course of the pandemic to date. What you see in this chart is the percentage of telehealth visits as across the total baseline visits. And you'll see that that started from a very, very low base in March grew exponentially to about 14% in the early peak of the pandemic in April and May, and then declined, likely as movement started over the summer, restrictions were loosened, and now has plateaued as of early October around 7%. Now, this 7% falls well short of the adoption potential I spoke about, where we said 20 to 25%, if not more, have the potential to be managed virtually. Now, this does vary quite a bit by specialty. For some, like behavioral health, we're recently seeing that this number hovers around more like 40%, whereas for primary care, it's more like 10%, and even lower for surgical and procedural specialties. Now, we wanted to try to get underneath some of the factors driving this decline and plateau that we're seeing. And to do that, we've surveyed physicians recently around their opinions on telehealth. And we found some interesting puts and takes with regards to their opinions. So the vast majority of physicians say that they're more comfortable providing telehealth now than they were pre-pandemic, and that they see telehealth as being more convenient for patients and view it more favorably than they did pre-pandemic. That being said, many physicians are not yet convinced that telehealth is as effective as in-person, even for the right type of visits. They also have questions about the implications on their practice operations and financial position that have yet to be resolved. So where does that leave us? This chart depicts conceptually what we've seen the progression to date and what the future progression of telehealth adoption could look like. So as you saw in the chart of visits, we saw initial exponential growth, a peak earlier in the pandemic, and now this decline. So the big question is, what will this progression look like going forward, and where will adoption stabilize? In terms of the near-term progression, obviously COVID-19 and the progression of the pandemic will have a significant impact here. We're already seeing spikes in second and third waves in many geographies, and that suggests that there may be increased use of telehealth over time, similar to what we saw earlier in the pandemic. The flip of that is that with fewer restrictions on movement, we may not see the levels that we saw back in April and May. And that being said, we also know that a lot of organizations are laying the groundwork and investments for more expanded use of telehealth applications and virtual health applications more broadly, as we saw in that provider survey data. So that has the potential to drive adoption in different types of technologies. Now, when and at what level this stabilized adoption will occur remains unclear, but that potential of 250 billion remains as something that the industry can use as a data point and a potential aspiration. So what challenges will need to be overcome for virtual health to really take off? We asked that question of the health executives that we surveyed, and they cited 6 big areas. On the funding side, what we've seen in the short term is parity for telehealth for certain services, and that's helped drive adoption on the provider side, certainly. What remains, though, are significant questions about what the long-term reimbursement model for telehealth and other virtual health applications will look like. And while there's still a desire to transition away from fee-for-service to value, that transition is not yet complete enough for the incentives for using telehealth to be clear. And as you saw in that provider survey data, providers have real questions around the financial implications and what this means for their practices. And providers, as you saw, are also unsure about what this means for quality and for patient experience and how they can incorporate virtual health best into their practices going forward. All issues that will need to be addressed to unlock adoption. On the consumer side, while consumers are much more comfortable with all things digital And the majority are saying that they're likely or very likely to schedule telehealth visits. Many of them are going off of provider recommendation. And so provider adoption and consumer adoption are closely linked. On the cybersecurity side, I'm not sure that we fully understand the level of vulnerability at the system, organization, or individual patient data level that we've now reached as a result of rapidly scaling technology during the pandemic, where much of the focus has been on getting that interaction, that care interaction to happen, and leaving open questions around how safe is that data and how safe are those interactions. And as consumers and providers access data, and more data from different places, the threat on this dimension is only going to grow. Another limiting factor that many executives cite is the notion of technology interoperability. And although there continues to be a movement in that direction, many see a major unlock in getting different disparate data streams brought together in a way that helps orchestrate and manage patient care in a more efficient and integrated way. And we know we're not quite there on the interoperability front. Lastly, from an operational perspective, clinical quality and workflow are also top of mind issues. Many providers are wondering how they incorporate both the physical and virtual into their practice in the most efficient way. And there are real questions around whether these visits are actually helping resolve issues or just creating more utilization. And now, across the board, stepping back from these factors, there's a major question that the industry is facing around return on investment. Is virtual health really going to drive cost savings? Is it going to improve health? And what will that look like going forward? And we're seeing many payers in particular start to ask that question. Again, on whether this is really resolving patient issues, on whether physician practices that use a high degree of virtual health are going to see better or worse health indicators among their patient base. And so this measurement is going to be very important going forward to try to answer some of those questions. So with that, I will leave you with a few questions. Which players in the industry do you think will break down these barriers to adoption? How will healthcare and frankly other organizations work to combat the fragmentation of care that some of these virtual applications might induce? And how will your organization play in virtual health adoption? Thank you.
Alex, this is Lyle Berkowitz, editor in chief for Telehealth and Medicine Today. Thank you so much for that keynote. Definitely a lot of great information. And now I get the honor of being able to interview you and talk a little about some of the questions that I have and hopefully some of the audience has. Um, so first of all, one of the questions you brought up, who's going to sort of own this, has been circulating in the context of, do we think healthcare companies and providers will eat technology, or that technology companies will eat healthcare? In other words, will healthcare systems figure out and own digital and virtual health themselves? Or will tech companies like Amazon, Google, Walmart start taking over more and more healthcare? Curious your thoughts on that particular topic without having to go into any specifics of which ones will do it. Who do you think will win?
It's a good question. I think there's no doubt that technology players have been and will be going forward playing an increasingly large role in the healthcare industry. I think to me what's interesting is the notion of the partnerships that are required to make this happen. And I think one of the reasons technology will become a bigger force and technology companies will be bigger forces, but they can't fully divorce themselves from the healthcare organizations, is that the technology companies have products and services that need to get to the patients that these healthcare organizations have relationships with. So I think that's why we're seeing very interesting partnerships across the industry. Well, that whether that's Mayo and Current Health on remote patient monitoring, whether that's Teladoc and Livongo. But I think this is indicative of the fact that combinations are really going to be required to get the technology in the hands of the patients and the providers. I think the other question is around this notion of ecosystems that I brought up, and how do those ecosystems get orchestrated in a way that brings together the right data and the right technologies, which the technology companies, you might argue, are better positioned to offer, but couples that with making in-person and virtual services with providers more seamless. So certainly technology will play a bigger role, but I think it'll need to be collaboration across organizations in the industry to really take full advantage of the potential.
Got it. So we won't be all going to Google and Amazon for all of our healthcare. There's going to need to be more collaboration. Um, and let's talk then a little more about what we'll call the virtual front door, that initial intake, triage, and perhaps very basic care. Um, in the healthcare system side, obviously, health systems have traditionally done that. Payers and employers have started to get into that, independent groups, government, etc. Um, who do you think is really the one best positioned to own that virtual front door, and or who will wind up owning it? Because that is, of course, the key in a lot of ways to um, triaging patients to the right level of care, and making sure the economics of online care are as efficient as possible for whoever that owner is.
You know, it's interesting. As you mentioned, each player in the industry has a different sliver of that, whether it's the payer with the longitudinal claims information, the providers with the actual patient relationships, the tech companies with the ability to aggregate data. So I think going back to the first question, there's going to have to be a lot of collaboration across each, because the capabilities and the type of information and relationships that they have uh, are quite distinct. I think that being said, you might argue that the tech companies are in some ways well positioned to do this from the data aggregation perspective, and from the ability to stitch together connections to different solutions in a way that they've been able to do, you know, more broadly in other industries. One segment that I think could take a more active role in this actually is provider systems that have their own health plans, because you might argue that they actually have some of the most aligned incentives to start to bring together the payer side of the world, the provider relationship, and use technology partners to help enable them to do that. So I would actually love to see some of the provider systems take more of the lead here, but I think that's going to rely on a lot of information sharing and rely on sourcing capabilities from tech companies that many healthcare organizations haven't traditionally done.
Yeah, that makes sense. I think there is a bit of a tension between, of course, the health systems and the payers. And so when they're the same organization, there is amazing alignment. And you're right, that's probably the the canary in the coal mine to watch and see how they do it. Um, Let me follow up on something else you said, which was around the technology companies getting into that. I'll go to pop culture for a second. You may or may not have seen the Social Dilemma documentary on Netflix. To remind everybody, it talks about the concept of surveillance capitalism, meaning that as we use a lot of online sources from Facebook to Google, etc., that if you are not buying the product, then you yourself are probably the product, and how they use data of everything we do online to target, advertise, and etc. more to us. Uh, what are your thoughts on how that intersects with healthcare, and um, where that might become an issue with some of these tech companies using our healthcare data, which we may willingly give up in some cases.
Yeah, it's an interesting question. I think to me, there will be real questions around what is the data used for. I think if people can see real value in that data being brought together, again, going back to this ecosystem concept, in a way that actually gives them meaningful information to manage their health and meaningful recommendations or connections to the right providers and the right services that they need, that can be hugely additive from a consumer and a patient perspective. I think on the flip side, if that information is used more for selling different products and services versus something that actually shows at least a meaningful improvement to consumers on access and convenience, that'll be another story, and people will be less willing to participate in that kind of data sharing.
I have a hunch there'll be another documentary called The Social Health Dilemma in about a year or two.
We
Um,
probably don't want to see what that will show.
Um, okay, so a stat you brought up, or what McKinsey is saying is you believe 20% of all outpatient and home health can be virtualized, representing $250 billion or so. And I wasn't clear. Are you saying that is in the next year, in the next 5 years, in the next 10 years, or that's the maximum that can be achieved? It felt a little low to me, at least for the far future. So help us understand timeframes and where how close do you think we are now?
It's a good question. I think we didn't put a specific time frame out, and we're probably looking more at like a 10-year time frame there. It was meant more to be analysis of the potential given what we know about technology today. So at least a theoretical maximum given our known constraints right now. I think certainly a lot of this depends on the adoption factors that I talked through, because it's not just can something be delivered virtually, but are the right incentives and tools in place for that actually to happen. And so I think, we're still quite far away from achieving that potential. And even when we looked at the telehealth visits, the 7% we're seeing now versus a 25% and above potential that we estimated, that's still a multifold difference in terms of reaching just the pure potential of basic telehealth visits, which you might argue are more traditional. The technology has been there for quite a while, and so when you extend that to even now more sophisticated applications, you're probably looking at a shorter timeline than we were pre-pandemic, but still not in the next couple of years.
So let's talk then a little about incentives and barriers. You brought up a number, obviously reimbursement being a huge important one that you can't really even get to the others if we're not getting reimbursed. There's parity right now for video phone, in some cases even asynchronous care. Some are saying that the payers are going to start pulling back in a fee-for-service model, but this may push us more towards value-based care. Wondered your thoughts on that. Are you seeing that trend, or what will be the harbinger of that? Because in those cases, one of the things that isn't represented, for example, in some of the data, is how much telehealth is being done for value-based care that isn't being billed for per se. But imagine a surgical or inpatient admission, which might have a 30-day window of a bundled payment where that telehealth is not getting billed for and not accounted for in some of the stats. Curious your thoughts on how much we think we'll see a rise in value-based care being pushed by payers and perhaps providers to enable them to do as much telehealth as they want without having to bill for each encounter.
Yeah, it's a good question, and I think there's a lot of uncertainty in the medium term or post pandemic, whenever that might occur, of what reimbursement looks like from pure fee for service perspective. I think the value based care question is interesting, and I think goes back to what I was talking about earlier on ROI and what that looks like. because certainly you could see telehealth being, quite a good element to have in the value-based care arsenal. But I think there are major questions around, does it actually give you value in a value-based care model? And so what we're seeing payers, for example, start to ask is virtual health creating induced utilization? So it's not just meeting, a need, it's creating new needs that may or may not have needed to be treated in the past. And is it really serving as a substitute for face-to-face interaction? So I think there's a question around utilization. And then I think on a quality question, I think there's a theory that if you get people to engage more frequently through different channels in their health, that'll ultimately lead to improvement on certain health indicators. I think, again, we're just starting to be in a position of being able to measure that. I don't think we have an answer. So I think if there is indication that telehealth really does drive ROI from a cost and also a health indicator perspective, that will be something that helps a push towards value-based care and something that providers will adopt more readily in those models. But I think we're in the early days of knowing whether that promise is really there.
Yeah, so diving a little deeper on ROI. Now, I came from the telehealth industry for a couple of years, and certainly we saw urgent care telehealth have some pretty consistent ROI with respect to decreasing ER visits, and saving money from that perspective. Um, we still, I think, as an industry, haven't fully explored all the ROIs around chronic preventive care, et cetera, or urgent care being delivered to everybody. Curious if McKinsey, if you can speak to this, is being called in by either health system organization, providers, and/or payers to do that type of analysis, and if so, how you're looking at it.
Yeah, absolutely. I mean, I think we're working with a range of healthcare organizations to answer these types of questions. So the types of questions I mentioned on the payer and the ROI side, but then also for provider organizations asking the question of specialty by specialty, what is that potential for virtual care and how should we be incorporating it into our clinical practice? I think on the provider side, another interesting question that's coming up is, how does the use of all of these virtual channels disrupt traditional referral patterns, and how the interplay between outpatient and urgent care and higher level care might change as a result of people getting their healthcare from virtual, retail, or other channels. So that's another area of an examination that we're starting to see provider organizations undertake in particular.
Yeah, what I found is in a world where the demand is greater than supply, if virtual health can improve efficiency for more routine care, it can open up space, so to speak, for the more complex care that might have higher value, whether in fee for service or value based care. Curious if you've seen or heard or think similar as one of the ROIs that's not simply of ER avoidance, but can also be appropriate level of care and time provided to a patient by a health system.
I think there's real potential there to have kind of efficiency and better matching of the right setting of care and the right level of care to the situation. I think through the pandemic, what we've seen is probably more of a replacement of an interaction that would have been face to face versus the true kind of optimization of what should be done virtually, what could be done virtually, and what should be reserved for face to face. But I think that's something we're also seeing providers who are have the capacity now to step back and say, how would we actually want to incorporate this into our clinic scheduling practices, into our clinic operations in a way that does match the right acuity of patient to the right intensity of care. So I think there is real potential there, but we're at least with many of the organizations I'm working with, there's just a period now of starting to step back and looking at that more holistically.
So, taking off on that, one of the other discussions around telehealth, is that simply taking a doctor and who spends 15 minutes with a patient in the office and having them do a 15-minute video visit doesn't provide a lot of health provider efficiency. So there's ways to make perhaps a telehealth visit more efficient. But at the bigger picture, the umbrella term virtual health, I believe, incorporates telehealth, where you have some type of online physician patient interaction with autonomous health, where you're also using a more computerized version, whether that be for triage or education, et cetera. And so I wanted to dive into that because you can certainly get some real efficiencies from this thought of autonomous care that can be include chatbots and AI and rules for doing a lot of preventive, urgent, and chronic care without a doctor involved. Curious if in your incorporation of how much care can be virtualized, you're also thinking about and looking at autonomous type care as well as uh, telehealth in which a doctor needs to be involved.
It's a good question. You know, we didn't make a specific distinction between autonomous care or assisted care in doing the analysis. It was more focused on what doesn't require a face-to-face interaction because, for example, there isn't a procedure associated with that particular code or service. I think the notion of assisted care and the use of symptom management and e-triage and supporting providers from a decision support perspective is going to accelerate and has accelerated, and as you said, has real efficiency advantages, but also preserves, when I talk about quote unquote assisted care, the relationship and the sign off of the provider. I think on autonomous care, as we would probably define it, there are a lot of legal and regulatory questions that are unresolved there in terms of what are we willing to do without the presence or sign off of a provider. And so I think assisted care will continue to take off, but I think autonomous care is farther, much farther out, despite the fact that the technology may be there. The technology is probably closer than we are from a legal and regulatory framework.
Yeah, I think that's very true. The concept of augmented intelligence helping the doctors is going to be a lot easier to accept by the provider community. And yet, I think we're starting to see the FDA nudge a little on allowing for a little more autonomous care, but we're certainly at a brave new world. COVID has certainly been accelerant, as you said. Um, any last words, Alex, on the next frontier for healthcare with virtual health?
There's a lot of potential, and I
Mhm.
look forward to seeing where we take it. And thank you again for having me.
Okay, thank you again for the time and information, and we really appreciate all the info you've departed on us.